Hello, I'm Pamela Davis. Welcome to episode 76 of the Well Done Life podcast. Hello, and welcome back to episode 76 of the Well Done Life podcast. I'm your host, Pamela Davis. If you're new here, hey, welcome. I'm so glad that you could join the party. If you've been here before, thank you. Thank you for continuing to rock with me. You know I love you deep. I'm so glad that you are just, again, a part of this process with me. So thank you again for being here. Before we get started with this week's episode, I really always like to make sure that I set the intention. I know if you've been listening before, you've heard it before, and hopefully it doesn't get too boring, but when you can recite it from memory, then I'll know that I've done my job. I like to make sure that I set the intention. So with everything, I look at this like we are building a house, and we are. This is about having a safe space. So with that safe space, we have to make sure that it's built on the right foundation. And that means that we need to make sure that this is built on clarity and that this is built on love. So first, clarity, because you got to know why you're here in the place in the first reason. For the first reason, this is about creating a place where women can come together, share our stories, and learn and grow from each other. That's really what it is in the crust of the matter. I truly feel that women are the foundation of society, and I also feel that we just don't have enough places where we can be ourselves, where we can share our experiences, the good, the bad, and the ugly, and we can learn from each other. Because there's everyone out here who thinks that they're an expert at life. None of us are. The thing to remember is, though, we are all an expert at our own experiences. So when we give ourselves room to be vulnerable, to share our fears, our doubts, our successes, our happiness, our joys, all of it, we give ourselves space to be able to allow someone to learn about us. We also give that person space to be able to understand a lesson that they may be going through, and that can help them be better on the journey than we were, and vice versa. I mean, that's what really happens. It's about iron sharpening iron. So that's why we come together and share our stories. I know I've been sharing my stories, and I share other women's stories with you, and that's what I want, because I feel like that good energy helps make sure that we have what we need to continue on the growth journey, the journey to living our best lives possible. So that's clarity. Love is always going to be the root of everything that I do, the root of this podcast, because that's the most essential thing in life. So this week, as always, I like to make sure that I send prayers into the atmosphere for you. I am first and foremost, obviously, always going to send you prayers of health, mental and physical health. I mean, the streets are wild out here with Delta, and I want to make sure that everybody is taking care of themselves and doing the right things. I'm not here to shame anyone into whatever decisions that you've made in regards to COVID or the panorama, panini, whatever you like to call it with me, because I like to make fun of it, but I know it's a really serious thing. And along that line, I want to make sure that I extend love, grace, prayers to all the frontline people, all the doctors, all the nurses, all the hospital workers, all the people out there, the teachers, and the parents this week. A lot of kids are going back to school. I know there's some hard choices are being made. I am definitely praying that we have a great school year for the kids, for the teachers, for the administrators. We don't really need to have any tragedies if we can. We've been through enough tragedies. So I'm praying love and prayers for you guys and health. I understand we all want to go back and move forward. I want to move forward too, but just make sure you are taking care of yourself, because health is wealth. I don't care what anybody says. Health is wealth. On top of that, I am also wishing for you to have prosperity. I'm wishing for you to have joy. I want you to just prioritize doing something for yourself, at least one thing this week that brings you joy, because that is so important in everything that you do. And I wish you love, because like I said, love is the foundation of everything, and I don't feel like there's enough love in the world. So we all need to make sure that we grab it and hold on to love when it's given to us. So I'm sending you hopefully with all of those great things. And kind of going into this week's episode, it's funny how we kind of started off with health as the first tenet. Wasn't anything I planned. I'm actually recording on Tuesday night. It is August. You see, I was about to say December, y'all. That's crazy. That means I've been up way too long. August the 10th. at 10:41 p.m. I'm recording a little early because I wanted to make sure that I got everything together. I have a great interview for you. Yes, bringing you another phenomenal woman that I cannot wait to share. And we're talking about health because health is wealth. And I think, again, as women, we are the foundations of society. We do everything, but the one thing that we do not do well is take care of ourselves. And so I discovered a wonderful educator, podcaster who is going to come together and share her knowledge in the health space with us so that we can help eavesdrop our way into some good health. So I am really excited about introducing you to Dr. Shalonna Battle. She is such a sweet lady. Believe me, we had a really great conversation. And when we first connected, I really did try her out because I was very curious about my own little health challenge and I wasn't getting the answers that I wanted. So I instantly gave her some insight and she was just very cool with it. I mean, it's not many people that you can talk about menopause with that you first meet. It's a different type of conversation. So that's why I knew we were connected and I wanted to make sure I shared her with you because as we are taking care of our mental health, we have to make sure that we take care of our physical health because it impacts all areas of our life. So we're going to talk about that too. So if you can stand by in 5, 4, 3, 2, 1, Dr. Battle will be with you.
First of all, I would like to say hello to the Well Done Life audience and to thank you for the invitation to be part of your show. I have been listening to your podcast as well, and I am a part of the Well Done Life. I don't know what you call your listeners,
I
but I
don't have
am
a
part of
hive
the Well
yet.
Done Life. Yeah, I am part of the Well Done Life Hive.
Awesome.
And
Okay.
I have loved every episode I've listened to so far. And so it's an honor to be here. So, as you all may already know, my name is Dr. Shalonna Battle, and I have worked in the area of women's health for over 14 years. My nursing journey started off as a labor and delivery nurse, where I was allowed to really share in the birthing process of hundreds, probably thousands of babies.
Oh, wow.
And I loved helping women and their families so much. And I really thought that it was an honor and a privilege to even really be in the same space or be with families as they're bringing life into the world. So I really enjoyed that. And I enjoyed it so much so that I actually went back to school and achieved my master's in nursing. And I became a women's health nurse practitioner. And I have been working in this capacity or in this role for almost 9 years.
Oh, wow.
And right now, I've been working in private practice. But prior to private practice, I worked for Planned Parenthood, where we provided care to many different populations of women. So, women who had insurance, women who did not have insurance, young women, older women. So, it was a really big, different population of women that I dealt with. And we also did some care for men as well at Planned Parenthood.
Oh,
So,
very cool.
yeah, so outside of working in the clinical aspect, I am also a nurse educator. So I teach nursing students how to become awesome nurses because we need awesome nurses out there.
Yes. Yes, we
Yes,
do.
yes, we do. I've taught many different courses, but of course, my favorite course to teach is maternity. It's kind of like my baby. And I've taught for many schools, but my most recent school was at Health Career Institute here in Fort Lauderdale, Florida. And speaking of education, I recently graduated from Florida Atlantic University with my doctoral degree in nursing practice. Prior
Congrats.
to thank you, thank you. It was a big accomplishment. Um,
Yes.
yeah. So prior to being at Florida Atlantic University, I received my master's from Frontier Nursing University. And a fun fact about Frontier Nursing University, it is one of the oldest nursing schools in the nation. And it was founded by one of the pioneers of nursing or the founder of nursing, Mary Breckinridge. And so when I
Oh,
found
wow.
that out, when I was matriculating at that school, I thought that that was
Mm-hmm.
such an honor to even be at that school. And, it was amazing. So if there are any nursing students out there who are listening and considering going back to further their education, I really, really recommend Frontier Nursing University. It is a really good foundation.
Wow.
So then prior to nursing school, I did go to one of the best HBCUs here in South Florida, Florida Memorial University. Go
Okay.
Lions.
I'm
And
going to
my
let that slide. I'm a rattler, so I'm going to let that slide.
Okay.
Okay. I was going to say, okay, that's debatable, but we're going to let that
Yes,
go.
it's debatable. Okay.
It's debatable.
Yeah. So then I did also my bachelor's program in nursing at the University of Miami. So go Canes.
Okay.
And
Yes.
that's kind of like my background and my
Wow.
my education and in my clinical practice. And just some fun facts about me. I am the host of the Eavesdrop podcast, which we'll probably talk about a little later
Yes.
in the episode. I love to read. I love to write. I love to learn. I love poetry. I like to go to live concerts, and I love the performing arts. I am part of the best sorority in the world, Delta Sigma Theta Sorority Incorporated.
Okay.
And lastly, but definitely not least, I love helping women achieve optimum health.
Wow. You are extremely accomplished, and I just am in awe of everything that you have been able to do. My goodness.
Mm.
So, has health always, and health and wellness or nursing always been something that you wanted to do as a career?
Mm-hmm. Honestly, to be honest with you, I started out wanting to do psychology at first.
Okay.
I wanted to be a therapist, and I learned that I wanted to be a therapist really early, like in elementary, middle school. I don't know where that came from at such a young age.
I'm saying, I'm like,
But
were you
I
on the
always,
playground giving therapy?
giving therapy to my classmates. I don't know.
Yes.
But, someone asked me one day, when I was younger, what do you want to be when you grow up? And psychology came out of my mouth, and I don't know why. But then, as I got older, I learned, more, that there are more careers out there. And I actually learned that I wanted to do nursing by attending my godmother. Well, I learned about nursing while attending a Take Your Child to Work Day.
Okay.
My godmother was a PACU nurse for over 50 years. And when I was in middle school, she invited me to go to work with her, and I was able to shadow her and a certified nurse anesthetist. So she was a PACU nurse, and I was able to kind of finesse my way in to kind of look at a surgery. And I was
Wait.
able to, I was in
You
middle
snuck
school and I
into a
saw,
surgery.
well, she finessed me in there. She snuck me
Okay,
in.
she finessed. Okay.
She finessed my way in there. So I was able to actually shadow a certified nurse anesthetist. So a certified registered nurse anesthetist is an advanced practice nurse practitioner who has a certification in giving anesthesia to patients. And so
Okay.
I was able to watch that nurse, and I watched her as she put patients to sleep, as she woke them back up, and she was so caring and calming, like as she was doing it. So I was like, you know what? I want to be a CRNA when I grow up. Forget psychology. I want to be a CRNA. And then
Oh
when I
my
learned
gosh.
how much money they made, I was like, okay, I'm sold. So I'm going to school to be a CRNA.
Yes. So it
I
was
went,
just a marriage there.
Yeah. So I went to nursing school, and with the desire to be a CRNA and to become a nurse anesthetist. And ultimately, I fell in love with labor and delivery.
Okay.
And my focus changed. But my experience in the OR at that time, at that age, guided my path to what I feel is now my purpose in life. So, children, if they still have Take Your Child to Work Day, parents, please invest in doing that, because it can really help your child determine what they want to do in life. So, yeah.
Wow, that is really powerful for that, because you're right. I mean, I can only imagine being able to see a surgery at that young age and being able to kind of be involved. You get the bug, and it seems like you have never looked back from that, which is awesome. So I guess since we're on the subject of healthcare, before we dive into the eavesdrop, because yes, I have a lot of questions as I hear more about your passion for healthcare. Obviously now you're more focused on empowering or working with women. What motivated you to really take that turn into regards to helping women in regards to healthcare?
So, number one, like I said, my career started as a labor and delivery nurse.
Right.
That's kind of where it all started for me. And I found myself always educating women, like educating every patient, how to breastfeed your baby, how to take care of your baby, how to take care of yourself after you have a baby. And I really fell in love with being able to empower women and equip them with knowledge. And as a labor and delivery nurse, I saw a lot of things that I wanted health. I saw a lot of changes that I wanted healthcare to make. Like I saw a lot of things that I felt needed to be changed in healthcare. So that's why I went back to school to further my education. And now, as a nurse practitioner, I have the ability to still educate patients, but to help them stay well so that they don't end up in the hospital. And, that is kind of why I developed the Eavesdrop podcast, because I love educating women. And, as we always hear all the time, people say that knowledge is power.
Yes.
And it is power in all aspects of our life. When we know better, we do better. And this is so important when it comes to our health. So having said that, I think that a lot of women do not get their questions about their health addressed because of so many different barriers, whether it be, doctors may not take the time to answer questions, or women may not know the questions to ask or how to ask the question, or their questions may seem too embarrassing, or it might be stigmatized. And so many women may result to receiving misinformation from poor sources, like on the internet. And so I just thought that this, podcast, and not only with the podcast, but just my role in the clinical practice, I just wanted to eradicate that, and just empower women.
I think that's so important. And like when we kind of talked before we sat down for the interview, I was telling you about one of my like health challenges that I was experiencing at the time, because I was like, I don't want my doctor to think I'm crazy calling her about these questions. And my gynecologist is more OB related. And I think, like you mentioned, a lot of women, we feel like we don't get the time and attention, especially, I hate to say it, if we don't have children, to ask those questions. I feel like, because I felt like my gynecologist at the time spent more time with probably people who were pregnant than they were with me. Because she's like, well, you're not having any kids, so okay, you'll be okay. And I'm sitting here like, look, I'm probably in menopause, and you're just like, it'll be all right. It'll be all right. I'm like, well, I've never experienced menopause, and Google University will have you believing everything under the sun. So I'm excited to hear more about the Eavesdrop. So obviously I can understand why that would be the reason why you would create it. Well, how did you land on the name, though, the Eavesdrop?
It was a play on words, really. You're listening to the podcast, and so you're going to, eavesdrop. Okay. But, I didn't want to, and I thought about so many different names, to kind of illustrate like women's health, but I didn't want to give off the impression that this was going to be the only thing that I would talk about. Because the podcast addresses everything from women's health concerns to pop culture. We have the wind down segment where we talk about things in the media. And so I wanted to come up with a name that was intriguing, that, made people who were thinking about listening say, to kind of reel them in, and, to make them feel like, it's going to be fun, because, that's what it's all about too. I like to make listening fun. And when it's fun, you're a little bit more intrigued. And so that's where it came from.
Well, then I think you probably answered my next question, because my next question was going to be what led you to expand beyond topics of health and into wellness? Because again, like you're so passionate and so knowledgeable about women's health. But when I was listening to your podcast, like I do love the Wednesday wind down. I definitely recommend everybody check it out. Her and her friends,
Yeah.
Dr. Battle and her friends are hilarious. And I like the fact that you're taking more of a holistic approach to wellness for women. Because I think, I mean, we are more than our bodies. We're soul and mind and so many different things factor into it. So
Yes.
is that, when did you kind of make that shift to realize that this just cannot be strictly health related? It's got to be wellness related.
Yeah, I went into forming this podcast knowing that I wanted it to be holistic.
Okay.
Because I feel that health should be holistic and all inclusive of not just the physical component, but the biological component, the physical, the psychological, and social aspects, because I think they're all intertwined and they all influence one another. You know, if the psychological component of someone's health is affected, then their physical and social lives will suffer as well.
Right.
Same difference if the physical component is affected, then their psychological and social lives will suffer too. So there has to be a balance. And I think that we have really missed this concept in healthcare because we become so caught up with treating the illness, but we don't really look into how other factors of someone's lives may influence that illness or how that illness is influencing other components of their life. And I'll bring up an example. I was listening to a TED Talk the other day, and there's this phenomenal physician who was talking about, and she was an OB-GYN, and she was talking about this patient who had been suffering from pelvic pain for years. She had been to numerous doctors. No one could figure out what was going on with her. And she had even been through a surgery called an exploratory laparotomy. That's when they open up the pelvis and they just explore to look for any type of reasons that, you know, there might be pelvic pain. She had been to orthopedics as well to address the pelvic pain, and no one could figure out what was going on with her. And because she's so well-rounded in the literature and so well-rounded in her research, she knew that pelvic pain can also be a psychological factor. Like there's some psychological components can play into women perceiving pelvic pain. And she talked to this woman about her social history and found out that the woman had been sexually assaulted before. She had suffered from depression because as a result of the assault. And she said, I think this woman is depressed. She gave her like a what do you call? I'm having a brain fart.
Is it like more like did she give her like a mood stabilizer or like an antidepressant?
She gave her a
Okay,
well, they gave her a questionnaire. That's the word I was looking for. She gave her a questionnaire to assess her for depression. And she was off the charts with the numbers. She was depressed. And so she sent her for a psychiatric evaluation, and then they started treating her depression. And when she came back to follow up with her pelvic pain was gone.
That's
and
awesome,
so
though.
Yeah, and so I brought that topic up because, you know, we look so much into the pathology of things, but you have to focus on the holistic approach. You have to, you know, talk to the woman about her social issues. You know, is there a social history? How is she doing, you know, with her family? You know, is she stressed out? Is there any history of a mental illness? Because those things always play a factor in our physical health as well. So I thought that that was a phenomenal example of why we need to take the holistic approach in care.
I think that's so important because, again, like we were talking about, you know, a lot of times, not saying all doctors do, but a lot of physicians, especially when it comes to women, do not talk to us. And I hate to say it, I think it's across the board, just because I think there is a lot of pressure to see a large quantity of patients. So when you see this large quantity of patients, you don't have the time to really sit down and have conversations, which I then think creates that barrier for women where we're not able to feel comfortable having that. And I have very rarely except for being full transparency, my mom gets assessed as a part of her physical exams. When she goes to the doctor will ask her, are you depressed? Because I think that's actually a requirement when you become a senior and you have insurance. But I have never myself been asked that. Not that I ever recall.
Right.
And so I feel like that's a missing component.
It is. It really is. I think a lot of providers might not dive into those questions because they don't know what to do if the person says, yes, I do suffer from depression, or yes, I have been a victim of sexual assault or violence. It kind of puts you in a situation because now I have this information. So now what do I do about it? And it's not a conversation. It's a taboo conversation really to have, because a lot of women are somewhat embarrassed to talk about it. Some providers might be embarrassed to even ask the question. So, but we have to move past that because we can really help so many women just by asking the appropriate questions.
I totally agree, because I was going to ask, what do you feel is one thing that women, what you would want women to focus on as it relates to their reproductive care and their wellness? Like, what is that one thing that they can do right now that could possibly make a change?
The number one thing is making sure that you have a provider who is listening to you, not hearing what you said, but actually listening to what you're saying and asking the appropriate questions and giving you the time that you need in order to find out what the problem is. Because, you have the power of the purse. I think a lot of women don't know that. You can really take your business elsewhere. If you're not getting the answers that you need, if you're not feeling as if you are getting the care that you need, you can always have a second opinion. And I always tell my patients that if you don't feel like you're getting the appropriate care, if you don't feel like you're getting your questions answered, don't feel obligated to stay with a provider because you like them, or because your family members go to them, because I see that a lot too. So, you are in charge of your reproductive health. You are in charge of your care. And so you have to make the appropriate decisions, and finding a really good doctor is number one. Number two, you and I discussed a long time ago. Well, you and I discussed recently when, during our pre-conversation about, some of the women, or a lot of women, who have not gone back for their mammograms or their pap smears. And I was saying that I heard on Good Morning America that 80% of women have not gone back. And over half of our patients from my own practice missed out on their exams last year, understandably. But I think too, it's time to get back in the office and get these preventative screenings done. Pap smears and mammograms are very necessary to prevent advanced and curable diseases. So we've got to go back and get these annual exams, and not just with women's health exams, but you need to see your primary care doctor too. You'll be surprised. I take care of so many women that come to the gynecologist for their primary care doctors. And I found it was so funny to me one day. I was asking one of my patients who I've been seeing for a long time. I asked her, I said, who is your primary care doctor? She said, you guys are my primary care doctor. I said, no, we're not. I said, we're not your primary care doctor. We are your specialists. We are your gynecologists. We take care of your lady parts. You need someone to take care of, to screen you for high blood pressure, to screen you for high cholesterol, to screen you for diabetes. So it's not just about our gynecological health, it's our overall health as well too. So I think there's a big misconception that women go to their their OBGYNs for their primary care needs, but you need to always have an established primary care doctor, and also visit them annually as well too.
Well, I will say this, and I definitely probably shouldn't tell it, but I'm going to tell it. I'm tell it by myself. I didn't do that. Like, I've never made my gynecologist my PCP, but for a while I hadn't gone to my primary care physician. I was going to my chiropractor. and utilizing my chiropractor as my primary care physician, because I was like, ultimately I was like, well, I had the mindset at the time, not saying it was smart, y'all, that, oh, I'm good, I'm good, I don't need to go. And then all of a sudden I realized I'm not good, I needed to go. And I had like this whole litany of things I needed to take care of: high blood pressure, my vitamin D dropped, all those things. And but that motivated me to be like, okay, Pam, it's time to reset and get back in. Because like you said, there are a lot of women who out here who treat this one or two specialists like you're covered everything, and that is not true. So I'm so glad that you said that.
Yeah, a lot of women need to hear that. And I'll be transparent. Before I got into being a nurse practitioner, when I was a bedside nurse, before I really knew any better, that was my focus too. I was just going to the gynecologist every year until my gynecologist was like, you need a primary care doctor. You need someone that's going to do all of your annual screenings, like your blood pressure and things like that. It's important. It's a part of your holistic approach.
Okay, so you mean to tell me, like, when the gynecologist takes your blood pressure, that's not enough?
It's not enough.
Yeah.
It is not enough.
Yes. So, and I'm saying that to like tell on some people and tell on myself. Like, we've all been the ones at the dentist's office, and the dentist is, I'll take your blood pressure, and it comes back wrong, and then you just, that's like, I need to get better. So yes, we need other doctors. With everything that you're doing, and then like with the podcast that you're empowering women with healthcare and wellness, and you're a nurse practitioner, how are you empowering yourself on this journey, ma'am? How are you feeding into you?
I know one thing that I always preach to my patients, and I'm starting to practice what I preach, is prioritizing. Okay. Doing this podcast, working full time, it can get a little overwhelming. And one of my favorite quotes that I'm living by is, if everything is a priority, nothing is a priority, because you're not going to get everything done. Everything cannot be important. So I've learned that things that have the least bit of consequence, if it's not done, it needs to go to the bottom, or to delegate that task to somebody else who can do it. I've learned that. And I've also learned to make taking care of myself a priority. And this means doing something that I like to do at least once or twice a week. And, this is how I refuel my engine. And I've learned, to let things go, or to even take a break from things if I need to, because I feel like my health is more important. My sanity is more important. Those things will be there when I get back. And if it's important enough, I'll get back to it. And I was listening to one of your podcasts the other day, and you were talking about romanticizing. And that was a new concept to me. Like, I had never really, I've heard, not the title for it, but I've actually heard about how to do it, but I didn't know that there was a name for it. And I actually looked it up, and I really find that it is a beautiful concept. It's a beautiful thing that women should really do to make themselves feel special. We shouldn't wait for anybody else to do it.
Oh, I totally agree with you.
Yeah. So those are some things that I've been doing to empower myself, to keep myself energized and ready to go.
That's awesome. And I'm so glad that you listened to that episode. Thank you. I'm learning to romanticize my life now, myself, because honey, I was just listening to your new episode where you were talking about you were not being a superwoman. And ma'am, I felt attacked.
Yep.
Because I was like, I'm recovering, and no matter how hard I try to put that cape up, it's always a struggle to keep it up, because you just instantly want to take on so much. Is that when you got to that point, is that the one thing that you would say that you've learned on this journey, like not to stop being a superwoman?
Yeah, I learned because it was coming to a point where I was forgetting the littlest things.
Mm-hmm.
I had trouble concentrating. I started having trouble focusing. And, that's really important in healthcare. You need to be able to focus and concentrate,
Yeah.
right? So I said to myself, it's because I have so much going on. I have too much going on. I need
Yeah.
to sit down and I need to really prioritize my life. And I need to get rid of the things that are not really, in priority, because we can only really do so much. And I came up with that episode because not only have I experienced it, but I see women every day in the office who experience it. And one of the things that I mentioned in the podcast is that a lot of women will put off going to the doctor, they'll put off taking care of themselves because they're so busy taking care of everyone else. And
Yes.
then by the time that they want to focus on themselves and go to the doctor, they have like an advanced disease that could have been
Right.
taken care of, if they had made themselves a priority, or not taken care of, but maybe prevented if they had gone to the
Mm-hmm.
doctor earlier,
Right.
And I think that we put too much emphasis on giving to others, although I do think that it is important, that we share what we have and that we help other people, but you can't do it at the expense of your own health. You
I
can't, and that's
Yeah.
why when we're on the airplane, before they take off, they always tell you, if we were to crash, you put the mask on yourself before somebody else, because how are you going to help anybody else if you are sick, if you are mentally incapable? So it's
Yes.
important. Yeah.
It is. And like you said, it's so easy. And the fact that, like you mentioned, you start forgetting things. I have done
Mm-hmm.
that when I was in
Yeah.
very stressful times. I was
Mm-hmm.
like, I think I let my tag lapse. I forgot to renew my license plate, and I
Mm-hmm.
got pulled over one night. And the guy was like,
Oh
"Do you know
no.
your license is expired? Your license plate is expired." And I was like, "Huh? I renewed that.
Mm-hmm.
What are you talking about?" And he's like, "Ma'am, it hasn't been renewed for like over a year." I had totally forgot. And I had
Oh
been just like
wow.
riding around. But I was so, if I think back to it, that's where I felt that in your episode when you were talking about forgetting things and everything, because I have
Mm-hmm.
done that. I have literally experienced those moments where I'll go to the doctor and the doctor's like, "You haven't been here in 2 years, right?"
Mm-hmm.
Because you lose
Yeah,
time. So I
you
can see what
do.
you're saying. Yeah, I totally see what
Mm-hmm.
you're saying about women coming in. If you're not careful, you could look up 2 years later and you're super sick when that could have been avoided by
Yeah.
you following up like you should and prioritizing yourself. So
Mm-hmm.
that leads me into another question then. So, like you were saying, you're trying to do more little things for yourself right now, 2 things a week to, at least try to keep yourself going. What are you currently passionate about?
Are you talking about as far as leisure or like the work that I do?
I'm gonna say, you know what? Since you asked it that both ways, I'm gonna make you tell me both ways. What are you passionate about
Mm-hmm.
leisurely, and what are you passionate about work life?
So leisurely right now, I'm really passionate about my podcast. I'm hoping that one day it will not be a leisure.
Yes.
um, but right now I'm really passionate about my podcast. I'm passionate about writing. I've, started a blog as well too. So I'm really passionate
Oh,
about
wow.
that. And the reason why I formed a passion from it is because I'm learning. I'm learning
Mm,
so much, and it's making me a better provider. Um,
okay.
because I'm learning new things from the research that I'm doing, and also from some of the guests that I've had on my
Hmm.
show who are experts in their fields. And I'm just learning from them. And I'm soaking up so much knowledge. And I've just been having an awesome time doing this. And because I enjoy it, I've formed a passion for it. And, of course, in working, I just have a passion for empowering women to just, take control
Right.
of their lives and take control of their health and placing them in the driver's seat of their lives. So those are the two things that are driving me right now.
Okay, so then just kind of flipping it a little bit. Maybe not, no. With this now being the start of like the third quarter of 2021, and obviously you're super
Mm-hmm.
passionate about your mind, about your podcast and your
Mm-hmm.
blog. What's one word that you would use to describe your mindset going into this time?
Ooh, determined.
Oh, yes, I can see that.
Determined. I am determined to get the word out to women. I am
Hmm.
determined to find out what is next for my life. I
Yes.
am so determined on gaining the following that I need, because I feel like not for publicity, but I want the
Hmm.
following because I want to get the word out and I want to reach so many women, especially those who
Right.
need the information. So
Yeah.
I'm determined. Mm-hmm.
I love it because I think what you're talking about is so important. And I hate to say
Mm-hmm.
it, we just, as women, we just put our health last
Mm-hmm.
so often, and it just doesn't make any sense.
Yeah.
So what's one thing that you would want my audience to know about you that you haven't already shared with us?
Hmm. One thing I would like to the audience to know is that I'm approachable. I think that a lot
Mm-hmm.
of people think that healthcare providers are not approachable and that it's hard to ask questions.
Mm-hmm.
I'm very down to earth and I'm very approachable. So if you have questions, if you have concerns,
Mm-hmm.
you can always reach me and I'll always respond. So I think that is something that's important to know about me.
I think that, and I appreciate that because I think, like we
Mm-hmm.
were talking about earlier, it's so important for women to feel like they have resources. That's why we created the Well Done Life. I wanted women to have that
Mm-hmm.
safe space where they could ask questions, learn, and grow from each other. So that just fits
Mm-hmm.
so well into this. How
Yes.
can we support you? Where can we find you? Tell us all the deeds.
Mm-hmm. Okay, so you can support by subscribing to the Eavesdrop. I am on Apple, Spotify, Google Play, and Anchor. Also, like as I mentioned before, I share the information with women who
Mm-hmm.
you feel may need the information. My goal is really to reach many women as possible with this information in hopes that more lives will be changed. You can stay in touch with the Eavesdrop on the website, the eavesdroppodcast.com. You can also listen to episodes on the website as well, and also on Instagram at the real eavesdrop underscore podcast.
Awesome. And I'm going to have everything in the show notes. So don't stress yourself, y'all. I promise I'll have it all written down so that you can collect it right there.
She's so
And
resourceful, y'all.
hey, I just want to make sure everybody gets it because, hey, I want to make sure everybody knows to support you because what you're doing is just so
Yes.
amazing. And I really
Mm-hmm.
do enjoy your podcast. And I enjoy the fact that you're so passionate
Mm-hmm.
about women. So, what
Yeah.
is next for you? What, with everything else you got going on? I know there's something else coming. What's
Yeah,
next?
so right now I'm in the middle of writing an ebook, and
Oh,
prayerfully it will be released and available in early November. I
okay.
would love to open my own practice at some point. That will come sometime in the future, but right now my focus is on the podcast, the blog, and definitely authoring some books. So the ebook is basically going to be about women getting back to the center of themselves,
Mm,
because that's something that I'm very passionate about, and
okay.
so definitely look out for that in November.
Oh my gosh, I'm so excited. I had
Mhm.
no idea about your ebook. You kept that a secret.
Yeah.
But I definitely want to make sure that when you get ready to release it or
Hmm.
whatever, please let me know. We want to share it. I want to
Yes.
support you and encourage
Hmm.
you on the journey. And I have just really enjoyed our conversation.
Hmm.
Like,
So did I. This
thank
was
you.
fun, and thanks so much for having me.
Oh no, it was my pleasure.
Hmm.
I'm definitely excited. I hope we can partner up again because I feel like for women's health, there's so many areas that we can
Hmm.
touch
It
and talk
is.
about, and
Yes.
wellness in general. Because you're right, it all kind of goes together. So I definitely
Yeah, it
want to
does.
thank you for your time, and I look forward to having you back. next time.
Yes, I look forward to being back. Thank you so much.
My pleasure.
Isn't she great? It was just so awesome to talk to Dr. Battle. Shalonna, I'm just so inspired by her passion for women's health. I really do feel like there's just not enough space created for women when we go to the doctor sometime to have open and honest conversations about our health. So I really think that you can get some great information from the Eavesdrop podcast. So definitely check it out. Like she mentioned, or like I mentioned, actually, I'll have all of her information in the show notes. I really definitely want to make sure that I share it and that you're able to connect with her. I hope you enjoyed this week's episode. I really feel really blessed to be able to have shared two phenomenal women with you in the past few weeks. Actually, last week, it was just such an honor as well to have Rebecca Jean Baptiste on talking about You Are Extraordinary and her journey as a life strategist and just being able to help find the balance, because it, like Dr. Battle mentioned, if you think about it, your health affects so many different aspects of your life. And when, like Rebecca mentioned, you're a mom and trying to run a business, or you're working on your job, as well as then like you're not taking care of yourself mentally and physically, it just all can explode. So I want to make sure that we are setting the foundation here that, we're having real honest conversations where everyone can learn something that's going to help you move forward. Because the well done life is not just about acquiring things. It's about living your best purpose driven life. And that looks different for every person on the journey. So you have to make sure that you guard your energy, you protect your heart and your soul. But you've got to make sure that this vessel, this temple, this body that you've been given is taken care of. You're not here just to produce life. You're here to live life. So you want to make sure that you are living it on the best possible terms. So I hope Dr. Battle, as well as Rebecca over the past week, were able to offer you some insight that will help you be able to grow. And I'm going to make sure I share last week's episode 75, because y'all know that's a milestone for me, in the show notes, as well as, like I said, I'll have all of Dr. Battle's information in the show notes along with mine. I'll be back next week. Please like, share, subscribe, follow everybody's stuff, because a lot of us have got a lot of stuff going on, but we just want to be a resource for you and connect. And I cannot wait to talk to you guys next week. I hope you have a wonderful rest of the weekend. Again, I want to thank Shalonna, Dr. Battle, for sharing her time and energy with us. And I want to thank you for listening. Talk to you soon. Bye-bye.